Welcome to the Critical Care Obstetrics podcast. I'm Dr. Stephanie Martin, Medical Director at Clinical Concepts in Obstetrics. And today we've got another patient interview. You guys love these interviews when we talk to real life people who have survived awful experiences in their childbirth process. And we find them to be really, really informative. So we're lucky today to be talking with Stephanie, who was told that she had postpartum peripartum cardiomyopathy. So for all you postpartum nurses out there, you're going to love this because this is really going to be focusing on you guys and your perspective. So I have some questions about her cardiomyopathy, and I want to see what everybody else thinks. Stephanie, welcome to the Critical Care OB podcast.
Thank you so much for having me. I appreciate it.
I can pretty much guarantee I won't forget your name because it's my name.
I hope not.
And I'm terrible with names otherwise, but so you have an interesting story also because you are a labor and delivery nurse. Is that right?
I am, yes. I became a labor and delivery nurse after all of this happened.
So that must have been quite an eye-opening experience for you. Did that drive your desire to become an L&D nurse?
It did in a way, yes. I always wanted to be a nurse, but I knew my first day of nursing school, I was like, labor and delivery is where I want to be. I've always had a passion for women's health, but that sort of was the finalization. Like, this is what I need to do.
Were you in healthcare at all when you gave birth?
I wasn't. No. No, I actually
Wow.
worked at a courthouse for 7 years. I was at the courthouse during that time. So.
Wow, that's kind of amazing actually to have the experience that we're going to go into and then embrace healthcare and want to actually go into labor and delivery. I bet it's informed your patient care perspective.
Yes, it has. It's made me a little more aware, maybe a little too much, a little too nervous for my patients at times, but it's given me quite a bit of information. So,
well, let's tell everybody about your birth story. So tell us about your birth experience.
So I had, it was my youngest, Harrison. He is now 6 years old. I had him in 2018. Went in, I started contracting, drove to the hospital with my husband, and he ended up being a stat C-section. So got all the way to 10 centimeters and went in for a section.
And you were term?
I was, yes. I believe I was around 41 weeks.
So the stat C-section was for issues with him or issues with you?
Both of us, kind of. From what I can remember, he had a hard time engaging into my pelvis. I would push, and then after looking at the strip and reviewing it, he was having some late decelerations, and his heart rate was very high, from what I can remember. And I wasn't doing well, so at that point, the doctor came in and said, "I think we need to really consider a C-section," which okay. I'm glad that I listened.
Yeah, and then so postpartum in the hospital. How long did you stay in the hospital?
Oh, I think I was only in there for a few days.
Okay. Did you have any issues that you can recall?
Not that I can recall. The C-section went great. I think it was just right before I left. Headache. I had a lot of swelling. I guess that was one of the biggest issues. I had a lot of pitting edema. So.
Tell us about that. What did that look like for you? And this was while you were still in the hospital after your C-section.
That was before I even went into labor. So I would remember working at the courthouse, and I had, I guess you would call it +4 plus pitting edema, where you would press down and it would stay indented for hours. And so I went in like that whenever I went to the hospital, and it was still there afterwards, postpartum.
Did you have any difficulty breathing?
Not really. It was right before I was discharged. I had a little shortness of breath. Whenever I would lay completely flat, I was a little short of breath. They would tell me, because I had the headache, they would say, "Well, lay flat. Let's see if this is a spinal headache. Let's see if it goes away." And the headache was still there. And I would be like, "I'm just a little winded," and I couldn't really sleep flat. So that was it.
Okay. And do you know if you had any high blood pressure issues during your postpartum stay?
So I don't think that I did at that time. Now my blood pressure runs very low, and we're taught, right? Look at the baseline of your blood pressure and kind of what you've been living at. I have very low blood pressure normally. And so towards the end, my pressures were, I think, like 120s, 130s, somewhere around there, systolic. Nothing that was concerning for preeclampsia or anything like that.
Okay. So let's just stop for a minute. So
Okay.
everybody listening who's taking care of a pregnant and postpartum woman has seen this kind of edema that you're talking about. But when we start hearing about edema with difficulty breathing when laying completely flat, you should be able to breathe laying completely flat. That's kind of a little red flag going off in my mind already at this point. So something clearly was going on. It's absolutely possible to have significant edema during pregnancy, even severe pitting edema, and have nothing pathologic, nothing, that's problematic. But it does require some kind of investigation especially when the symptoms start increasing, like headache and like difficulty breathing when laying flat. So you get sent home. And what happened? How long did you stay home? Because I think everybody's figured out you get readmitted to the hospital.
Yes,
so
I did. Yeah.
I don't think we're not giving anything away there. So
Right.
what happened when you went home? How'd you get readmitted?
So I went home and I went to my daughter's birthday party, and there was actually a nurse friend of ours who was there, and she said, "You don't look so great." And I was like, "I don't feel so great." I was very swollen. My feet were very swollen. I was just a little winded walking around. And that night, whenever I got home, she said, "I think that you should go to the hospital." And I was like, "Well, they sent me home. I'm probably fine. They told me it would just go away. The swelling will go down." So that night, I started with a severe headache, worst headache of my life. And I remember walking. Our laundry room at the time was not far from our bedroom, and I remember taking just a few steps to the laundry room, and I physically could not breathe. I felt like I had an elephant sitting on my chest. And I looked at my husband and I said, "Something is seriously wrong. My head is hurting so bad. I can't see." I was crying, almost hysterical, really. It was just so bad, and I couldn't breathe, which I think was making it worse. Just the anxiety. And I think at one point he said, "Are you sure you're not having anxiety?" And now it's a big joke. I was like, no, something's truly wrong. So at that point I said, "I'm going to just call up there and talk to somebody and see what I need to do, because something's not right."
And you're 100% something is not right.
Correct.
And let's talk about that anxiety a minute. Anybody who's listened to us on the podcast knows how we feel about anxiety. And yes, women can have anxiety disorders and need treatment for that. But this anxiety is another symptom, probably of hypoxemia due to something, or poor perfusion of some sort, that's causing your body to react in a predictable way. Your body is trying to force you to do something about it. So that anxiety symptom is kind of supposed to drive you to do something about it. Like you aren't going to be able to tolerate it. So, okay. Were you able to lay flat?
No, not at all. No, I could not lay flat at all. I would get even more short of breath. I mean, I had to sleep on like 3 pillows, and even then I was still a little winded. It was worse on exertion, but whenever I would lay flat, I physically felt like I could not breathe at all. My chest was so heavy.
I'm sure you couldn't breathe.
I couldn't.
So at this point, let's think through a differential diagnosis. Like, what could this possibly be? And I'm not going to put you on the spot,
right.
But I'm just, for all of you listening, the things that I think of immediately when I've got a patient who's basically saying shortness of breath, can't lay flat, 3-pillow orthopnea, massive edema, and anxiety. I'm thinking we've got hypoxemia, probably from cardiogenic or non-cardiogenic pulmonary edema. We could have an aspiration. She did have a cesarean, although it's less likely because she didn't go under general, correct?
Correct.
Okay. We could have a pulmonary embolism. Absolutely could be explaining this. We could have preeclampsia. And we could have all of those things in combination. There could also be an infectious etiology. This could be sepsis or even septic shock brewing. So we need to do more evaluation. So did you put up a fight to go into the hospital, to the ED?
I did not. I was told to bypass our local hospital and go to where I delivered. And the provider that I spoke to, she said, "We will be waiting on you in the emergency department." She said, "Come straight here right now."
So is your local hospital very small and doesn't have OB services, or what's the situation there?
They do, but it's not known. I actually think very highly of their labor and delivery unit. I didn't know much at the time, but I did some of my clinicals there. But I don't think that it has the best reputation just for the whole hospital in itself. And I think that this provider wanted me to come where they were at and where I was treated before. But it's about a 45-minute drive.
Okay. Well, that makes sense. I mean, it makes sense that you would be advised to go where the people who have cared for you and have your records and know you can take care of you. So were they waiting for you in the ED?
Oh, they were, yes. From what I can, this is where things get very blurry for me. And my husband has to kind of remind me of things that happened. But from what I can remember, they were there waiting with a wheelchair to put me into it as soon as I walked through the doors.
Okay. So what happened when you got there? What do you remember?
I remember going back to the room. I remember feeling like I can't breathe. My husband said, I think my O2 sats were in the 80s. They put a mask on me. I don't know if it was BiPAP or what it was, but I remember fighting it off, and my headache was terrible, and I was crying. And I remember him trying to get somebody in to help me. And I think I was a little combative from what I understand, because they had to give me Haldol, Dilaudid, all these different things.
Okay, let's stop for a second there. Okay. All of you OB nurses out there, when was the last time you gave Haldol to a patient? I've given it a couple of times, but those were for patients who have true psychiatric conditions. I've worked in hospitals that had lockdown psychiatric units, and we were the consulting OBs, et cetera. And there are definitely indications for Haldol, but this is not it.
Right.
Okay. You needed oxygen. You needed your brain to be perfused with oxygen. Of course you were fighting because you were suffocating.
Yeah, it felt
That's
like
what it sounds like to me.
It felt like
it. So the treatment is giving you oxygen and getting rid of the underlying problem, not to treat your combativeness with a sedative that could also affect your respiratory drive.
Right.
And I will tell the listeners, I did have an opportunity to look at some of your records that you shared with me. And they also then, once you got the Haldol and a couple of other medications, you got restless leg. And then they started giving you benzodiazepines to treat your restless leg and your anxiety.
Yes.
And that's further going to depress your respiratory drive. And we still haven't dealt with the primary problem. So you're in the emergency setting. They're trying to put a mask on you. They're trying to get you to cooperate.
Right.
And what are they telling you is going on? Do you remember any of that?
I don't remember hardly any of it. I don't, to be honest with you.
Okay.
I don't know. Okay. I just know that my oxygen was low. I remember them putting that on me. And then from there, I don't remember a whole lot until later on.
Yeah. So I looked at your records, and I can tell you a little bit about what was going on. I know you're aware of this, but don't necessarily have a primary memory of it. But basically, you were very hypoxemic in the 80s, and you were hypertensive. And you were ultimately seen by a general OBGYN who diagnosed you with preeclampsia.
Okay.
They put you in the ICU and then started you on magnesium at that point.
Yes.
Your labs were interesting because you were severely anemic. Your kidney function was normal. You had elevated liver function tests. So here's what we had. We had hypoxemia, hypertension, severe headache, elevated liver function tests, and I feel like something else there. Anyway, that's where we were when you first get admitted. So you clearly have preeclampsia with severe features by hypertension, severe headache, and liver function test abnormalities. So you had preeclampsia with severe features. So for all of you listening, postpartum nurses, ED teams, anybody listening here, in a patient who has preeclampsia with severe features with hypoxemia, the number one thing you're worried about is not peripartum cardiomyopathy. It's cardiogenic or non-cardiogenic pulmonary edema. So the most likely explanation right now for your severe hypoxemia is pulmonary edema. That's it. Yes, you could have had a blood clot in your lungs. I mean, what's the odds that you've got a blood clot and preeclampsia with severe features? Right. Yes, you could have had a pneumonia. In fact, your x-ray suggested infiltrates, and they treated you for possible pneumonia. I think that was probably all consolidation from fluid, in my opinion, because you were afebrile. You had no other evidence of infection. You didn't have an elevated white count, et cetera. So most likely that was just a misread on the x-ray.
Okay.
It just doesn't make sense that way.
Right.
And then they did the right thing. They admitted you to the intensive care unit. They treated your blood pressure. They put you on magnesium, and they did an echo.
Yes.
And here's where the confusion comes. So what were you told about your echocardiogram?
I was told that I had, they said peripartum cardiomyopathy and heart failure is what they told me.
Yeah. So I hate the term heart failure. It's used all the time. You're not using it incorrectly. It's just so nonspecific. It's like saying headache.
Right.
Well, is it a migraine? Is it a tension headache? Is it a spinal headache? Like, it's so generic of a term. So in our world, we like to be really specific and say cardiogenic or non-cardiogenic pulmonary edema, just because I think it really helps you distill down what the problem is. And with preeclampsia, it could be either or both. All right. So I'm going to share your echo findings because you were kind enough to share the results. And so I'm going to share your echoes and let everybody listen to it and see what they think about it.
Okay.
So just for the baseline, by the way, were you normal weight, overweight at the time you had your son? Edema aside, like let's say pre-pregnancy.
No, I was not overweight. I was 127.
Okay. Did you any history of hypertension?
Never.
Any history of heart disease of any kind?
Never.
Right. So you were a pretty typical patient coming in to have your baby with no red flags as to you could have some heart condition.
Correct.
Okay. All right. And that's important because of what we find. So the findings were borderline dilated left ventricle with normal wall thickness and mild global systolic dysfunction. Here's the key part. Ejection fraction 45 to 50%. Full stop. Okay? We'll do a record scratch. That right there tells me you didn't have peripartum cardiomyopathy. Because the diagnostic criteria for peripartum cardiomyopathy include a left ventricular ejection fraction of less than 45%. You don't have to have dilation, but less than 45%. And you weren't. So number one, you didn't.
Okay.
You also had some diastolic dysfunction, grade 2 diastolic dysfunction, which can happen just when you have left ventricular dysfunction. I'm not a cardiologist, but it also suggests that possibly there was something else going on, or it may just have been because you also had systolic dysfunction. The right ventricle was normal in size and function. That's good because that tells us we don't need to be worried about high blood pressure in the lungs or right heart failure. And that's important because they were blaming your elevated liver functions on your right heart failure, which is not the case. Okay. And mild to moderate mitral regurg, that's not a significant clinical issue. That's just related to everything else that's going on. So your heart was really not explaining all the edema and the pulmonary edema. Okay. Maybe a little bit, but not the way that they labeled you. How does that sit with you?
Yeah, I've thought this whole time that's what I had, right? The cardiomyopathy. So it's a little it's interesting to hear this and to be learning this.
Yeah. And just for the listeners, I'm not hitting this with her right now. We've had discussions about this.
Yes.
So I don't want everybody to be thinking I'm like giving you a shock right here for shock value on the podcast. But I want you to understand, I want everybody to understand, this is someone who's been living with this label ever since she had her baby. And it's been perpetuated because you had follow-up, correct?
I did, yes. Yes. I have had
So
multiple echoes and follow-ups after that. I mean, I was on medication for a year and got off of it and then got put back on it. Multiple echoes and everything.
And what did your echoes and your follow-up show afterwards?
My ejection fraction was back to normal. So I believe 55, somewhere around there, 55 to 60.
Did your ejection fraction ever go below 45 that you know of?
Not that I'm aware of.
Yeah. And the blood pressure medicines that you were on, what were they telling you were the reasons for those?
So I was on metoprolol from the beginning, and they put me on something different. I can't remember exactly what, but something different so that I could breastfeed. And then I got off of those, and then they put me back on the metoprolol because they said I had an irregular heartbeat and tachycardia.
Yeah. So let's talk about metoprolol just a little bit. Metoprolol is a beta blocker. That in itself is safe to use. I think you might have been on an ACE inhibitor that they thought they wanted you on something different. You can breastfeed on ACE inhibitors too, but sometimes we'll change you just because there's a decent alternative that has no concerns. So, but metoprolol is a beta blocker, so it's going to control your heart rate, and it's commonly given to improve cardiac output in patients who are tachycardic as their cause of their hypertension or the cause of their decreased cardiac output. If you don't have enough filling time, for example, it'll lower your blood pressure, which is good. So, but it's a pretty benign medication. Most people tolerate it just fine, whether they need it or not, quite frankly. So I, from my perspective, that doesn't necessarily confirm. Well, first of all, you don't have peripartum cardiomyopathy, and it doesn't confirm that you did. It might confirm that you had some persistent hypertension, which is not unusual in women who have preeclampsia, that they have persistent hypertension for a period of time after. But you don't have peripartum cardiomyopathy. So let me just go through the diagnostic criteria for peripartum cardiomyopathy. The key point I want people to hear and want everybody listening to understand is just because you have what is considered to be a cardiomyopathy or quote heart failure or quote pulmonary edema around the time of having your baby does not mean it is a peripartum cardiomyopathy. That is a very specific diagnosis. And there's really three criteria: the development of heart failure in the last month of pregnancy or within 5 months following delivery. The second is no other identifiable cause for the heart failure. You had preeclampsia with severe features as a potential cause. And the last is systolic, left ventricular systolic dysfunction with an ejection fraction of less than 45%. So all you had was the first development of heart failure after pregnancy.
Right.
You had another identifiable cause that was far more common than peripartum cardiomyopathy, and you didn't have an ejection fraction less than 45%. So you had pulmonary edema, but you did not have peripartum cardiomyopathy.
Correct.
Okay. Now, there's a couple other things that were setting you up for this. I looked at your labs. You had a hemoglobin of 8.1, so you're pretty significantly anemic, and you had an albumin of 2.5. So those two things are major oncotic forces. And when you have low oncotic pressure, you're not going to hold fluid in the vessels very well. So it's much more easy for it to leak out into the lungs to pulmonary edema. So if you have preeclampsia, you have any excess volume like boluses for C-sections and epidurals and spinals and all those things, then you can easily get into a fluid overload situation, overwhelm the heart. And if you've got any vascular damage from your preeclampsia, it's going to leak out. So you were really a setup for it. Okay.
Wow.
So that doesn't surprise me at all.
Yeah.
But I want to know, I've been doing all the talking here, and I want to know how this diagnosis, like you and I talked a while back and I shared this with you, and I'm sure you've spent a lot of time thinking about the impact of this. Like, share your thoughts on what it's been like to live with this label of peripartum cardiomyopathy for 6 years.
Yeah, so I mean it's been scary. It's been, I've been told, oh, you're more likely to go into cardiac arrest whenever you get older. And, now I think that there's some things that have been different, like working out at a very high intense level is difficult for me. My heart rate gets super high, and I haven't been able to do that since. I am still active and try to take care of myself, but I have to do it at a much lower intensity. But I've always been terrified, that what can happen to me in the future because of this peripartum cardiomyopathy, because I've looked into it and I've been told all of these bad things that can happen. And, I've been told for years, you cannot have any more children. If you have another child, you will more than likely die. Right. So this was my third. My husband had to be convinced to have this one. So he did not want any more after this. We were done, thankfully. Because then I started having some cycle issues and things like that. And I was basically convinced and then talked to the OB to go ahead and have a hysterectomy, because if I were to have another kid, I could die. So it's really interesting to be on this side of that and a hysterectomy, and to hear that that's really not what you had. I mean, it's a little crazy, honestly, to process that.
Yeah. And I think it's important for you as a patient, but also for everybody listening to know that we've kind of changed the risks. We've modified the risks. It doesn't mean that you didn't have a health issue, and it doesn't mean that you don't have health risks going forward
Right.
in your life. It means it's not what you were told.
Right.
And I know that the team taking care of you had wonderful intentions. They just didn't know what they didn't know.
Right.
And this is common, where any heart failure around the time of birth is just labeled as peripartum cardiomyopathy and nobody thinks twice about it. But that has huge implications for a patient.
Absolutely. It absolutely does.
So I think it's really important to, for you were done with your childbearing, but not everybody is. And this can influence them hugely. So you had preeclampsia with severe features complicated by pulmonary edema. And that has health implications. Women who have a hypertensive disorder of pregnancy are at significant increased risk of cardiac complications, cardiovascular disease in their lifetime. Absolutely, no question. And it's not unusual for women with preeclampsia with severe features to require antihypertensive medications for a period of time after birth and then commonly wean off. But it's important for your health that you know that and you get the appropriate follow-up.
Right.
Now, for the listeners and for you, if you're interested, Suzanne and I both have been consulting with the American Heart Association, and we've been creating a lot of education modules that the American Heart Association has engaged us to do. And I'll put all the links for those in the show notes. It's free continuing education for anybody who wants to learn more about the cardiovascular risks of hypertensive disorders of pregnancy for women. Again, it's just free continuing education for anybody who's interested, supported by the American Heart Association that we've been part of creating. So some resources there, because we're learning so much more about the long-term effects. It doesn't end when you have a baby. So what would you say to one of your patients if they were having difficulty breathing when they're getting ready to go home from the hospital and they're feeling like they've got a headache, they can't breathe well when they lay flat? Like, what would you do as a nurse differently? Or would you do anything differently? How would you talk to your patients in that situation?
If they were getting ready to be sent home and be discharged, my conversation would start with a provider. I would do whatever I could. Yeah, I would advocate for them 100% after what I went through to stay there. Now knowing what I know, I think that I would just try to ask them all the right questions to figure out really what was going on. But I don't think that I would feel comfortable having them sent home if I was their nurse at all.
Yeah, it's interesting in hindsight, isn't it? And of
is.
course, it's real easy for us to be quarterbacking right now, but
Right.
I just want everybody to think critically, right? Vital signs are vital.
Yeah.
Do your assessments, figure out whether your patient actually is ready to go home or if she's just an exhausted new mom.
Right. Yeah.
I mean, exhaustion's real. I get
is,
that,
yep.
but there's also pathology. So,
Right.
Are there any thoughts you want to share with the nurses and docs listening to us about your experience?
I think just, I hate to say this, but do your research. I feel like as nurses and as patients, we trust our providers, right? We trust them to make the right decisions for our health, to send us home safely. And I do think that everybody wants their patients to be safe, and no part of this was any of this intentional. I don't believe that. I had a great care team. But do your research and stay caught up with things that are changing, and really advocate as nurses, advocate for your patients. If something doesn't seem right, advocate for them. Don't be afraid to say something to the provider and kind of stick up for them and say, no, this is really what I think, or go with your intuition, with your gut. Sometimes as nurses, we have to kind of be the bad guy in a situation and advocate for our patients at times. And I wish that somebody would have done that for me. I don't know if anything could have been prevented if I would have stayed instead of being sent home. Maybe not, right? But I like to think that maybe so. Maybe it wouldn't has been as bad. But research and just if you aren't sure about something or 100% sure, don't make that diagnosis. Don't make that call. Don't be afraid to reach out and get knowledge from someone or somewhere else.
Stephanie, how long passed from when you were discharged to readmitted?
3 days, 2 days, 3 days, somewhere around there.
Mm-hmm.
It wasn't long.
Yeah. Yeah. Well, I love when nurses trust their gut and trust their instinct. But I'll tell you what will give you the confidence to trust your gut and your instinct is knowledge.
Yeah.
So we have our obstetrics critical care, our critical care OB Academy that will help you get the knowledge so that you have the confidence to speak up and stick to your guns. We're getting so many messages from you guys that are doing it and that are talking about how they now, they're giving us specific examples of where they now have the confidence to stick up for their patients and to stand their ground and not be told no.
Right.
Somebody sent us a direct message about how they figured out how to make it the resident's idea to do the whole workup because no one was listening, and they're like, I just made it seem like it was their idea. And I thought that was brilliant. I mean, you got to do what you got to do for your patients, right?
Right.
Well, Stephanie, thank you so much for sharing your story. And I know our listeners are loving this and really are putting themselves in your position, both as a patient and as a nurse. Mm-hmm. And I'm really, really grateful that you were willing and reached out to share your story with everybody. So thank you.
Yeah, thank you so much for having me. I really appreciate it.
Thanks, everybody, for listening. Don't forget to subscribe and leave us a review. You can learn more about our company at www.clinicalconceptsnob.com. I'll have in the show notes the things that we talked about today and those resources. You can follow us on all our socials, Facebook, Clinical Concepts in Obstetrics, X at OB Critical Care, and Instagram at Critical Care OB. We're also on LinkedIn. And feel free to email us or send us a direct message for any suggestions on future podcasts.
This podcast was produced by Austin Baird. Are you looking to create a podcast? Please email me at podcastnashville@gmail.com. That is podcastnashville@gmail.com.